Okay. So good afternoon. We just got off the floor. Welcome to the Health and Government Operations Committee. This is voting list number 5. Actually, and today is Friday, March the 1st. May I have a motion for the withdrawals? We have 5 of them. It's been moved and second. All those in favor say aye. Any opposition? Seeing none, it passes. They're withdrawn. Let's go to House Bill 367. It is a bill that is jointly assigned with appropriations. They're primary, we're secondary. It is Delegate Smith, Community Colleges Contraception Access Requirement. It was voted out of subcommittee, favorable with amendment. It is Aaron and Bagnall. Aaron. Oh, and actually it's Michelle. Michelle, would you like to introduce yourself?
Thanks, Madam Chair. My name is Michelle Lambert. I'm counsel to the Appropriations Committee, and I'm here to present House Bill 367. The bill requires each community college, in consultation with students and student organizations, to develop and implement a plan to provide students with access to over-the-counter contraception. There were 2 amendments that Appropriations voted on. Amendment number 1 is technical. Amendment number 2 alters dates of certain reports and adds requirements for the plan that's adopted by the community colleges.
Thank you. Are there any questions from the committee regarding the amendments? Okay, Delegate Alston.
Thank you, Madam Chair. I don't know if it was this bill or another bill that we looked at that also required the colleges to give information about more like family planning and healthcare for women that want a different bill. Okay.
Yeah, that was a prior session.
Okay, thank you.
You're welcome. It's a good question. Delegate Johnson.
Thank you, Madam Chair. I just have a question. It says provide access to over-the-counter contraception. So what does that mean exactly?
Yes, thank you, Michelle.
Thank you, Madam Chair. It would be up to the plan for each community college to determine what that looks like. So it could be a vending machine, it could be providing a space for students to go to, but it would be up to each community college to define what access looks like.
Okay. Thank you. Any other question? Delegate Kipke.
A lot of people between us right now.
Okay, it's okay.
I assume this would include the Plan B, but could this include however you say it, mifepristone? That's the abortion pill. Now, the morning after pill is one thing, which I'm sure would be included, but I want to know if it's possible for the word that I can't say properly that has recently been made over the counter. CVS and Walgreens are going to carry it in their stores.
So we confirmed to the department it'd be condoms, Plan B, and the over-the-counter birth control pill. That's more outside my area of expertise in health for that. So fortunately, I don't know the answer to that.
Okay, well, I don't think it will change anybody's votes, but if we could know that by the time we get to the floor, that would be helpful. I can write down the spelling of the word that I can't pronounce it. Thank you.
Thank you for the question, Delegate, and thank you, Michelle, for looking into it. Any other questions? Seeing none, all those in favor of the amendment say aye.
Aye.
Any opposition to the amendment? Seeing none, on the bill as amended, we're secondary. Is there a motion?
Move the bill as amended.
It's been moved and second. Any questions or concerns? Seeing none, all those in favor say aye.
Aye.
Any opposition? And I'm just gonna call your name, not to single you out, just to make it easier for staff. Shalega, Chisholm, Morgan, Riley, Hutchinson, and Kipke. And thank you very much for this discussion. Michelle, you're welcome here anytime.
Thank you, HGO.
You're most welcome. Have a blessed weekend. So we're gonna go to House Bill 84. It is Delegate Kerr, Hospitals and Urgent Care Center Sepsis Protocol, Lactaline's Law. It was voted favorable with amendment, and the analyst is Aaron, the chair, Kerr. Aaron.
This bill requires each hospital and urgent care center in the state by January 1st, 2025 to implement an evidence-based protocol for the early recognition and treatment of a patient with sepsis, severe sepsis, or septic shock based on generally accepted standards of care. The bill also requires hospitals and urgent care centers to require periodic training for staff in the implementation of the protocol. There are amendments on pages 1 through 3, which were adopted in the Government Operations and Health Facilities Subcommittee. The amendments strike specific requirements for the protocols and instead require the protocols for hospitals to comply with CDC sepsis guidelines. The amendments require specialty psychiatric hospitals to establish a process for the screening and early recognition of a patient with sepsis and procedures to transfer the patient to the appropriate setting. The amendments strike language requiring hospitals and urgent care centers to collect and use certain quality measures and strike language requiring a hospital or urgent care center to provide the protocol to MDH on request.
Delegate Kerr.
I thank Aaron for crafting this amendment that resulted from extensive discussions with the Maryland Department of Health, Maryland Hospital Association, and representatives from the urgent care community that clarifies everyone's role. And I move the amendment.
It's been moved in second. Any questions or concerns regarding the amendment? Seeing none, all those in favor say aye. Any opposition? Seeing none on the bill as amended. It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Any opposition? It's unanimous. And who does not want to be on the bill? All right, everyone wants to be on it. Thank you so much for your work. We have next House Bill 149, Delegate Pippy and Kerr, Medical Records Destruction Authorization. It was voted favorable with amendment. The analyst is Aaron and the chair Kerr. Aaron.
As amended, House Bill 149 prohibits a healthcare provider from destroying a record, laboratory report, or X-ray report about a patient for 7 years rather than the 5 years that's authorized under current law. And after the report or record is made, or in the case of a minor patient, for 7 years after the patient reaches the age of majority. The bill also requires a healthcare provider to make the record that is proposed to be destroyed available for retrieval by the patient within 60 days before the date of destruction at the location designated in the notice of destruction. There are amendments in your packet that were adopted in Government Operations Subcommittee. The amendments retain current law related to notification and strikes language prohibiting a healthcare provider from destroying a record unless certain written authorization is received from a patient or the patient's parent. The amendment strikes certain requirements to be included in the notice to destroy the record and instead retains current law related to notices to destroy records, with the addition that the notice can be sent by first-class mail and by email.
Delegate Kerr.
Thank you, Madam Chair. The
You're welcome.
amendment addressed concerns by MedChi, and I move the amendment.
It's been moved in second. Any questions or concerns regarding this amendment? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing none on the bill as amended?
The bill.
It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye.
Aye.
Any opposition? The bill passes. Who does not want to be on this bill? All right. Next, we have House Bill 328. It is Delegate Lopez, Hospital Financial Assistance Policies Revision. It was favorable. Aaron and Kerr. Aaron.
The bill modifies the required components of acute care and chronic care hospital financial assistance policies by prohibiting hospitals from considering household monetary assets in determining eligibility for free and reduced cost care, and removing the requirement that the provision of reduced cost care or payment plans be in accordance with the mission and service area of the hospital. There were no amendments.
All right. And this is actually Kerr. You're popular today.
Thank you, Madam Chair. There was some discussion in subcommittee about people who are income poor yet asset rich. We are confident that the bill addresses that and will not permit people who have hidden wealth to be able to avoid paying their hospital bills. I move favorable.
Okay, it's been moved and second. Any questions or concern about this bill? Vice Chair Collison.
Thank you, Madam Chair. Not a concern, just a question. How many hospitals currently do not use asset tests to get financial eligibility?
Think 4 of them?
20.
3?
20.
20. Oh, it's the other way around.
22.
It's the
Yeah.
big number, not the small number.
Yes.
Yes.
So it's 22. Okay,
Not use an asset.
okay. 22, let's write it down. Okay. Thank you for that question. We appreciate it. Thank you. Thank you. Any other questions? Yes, Delegate Hutchinson.
Thank you. I just want to
welcome.
confirm with council, I'm assuming the Maryland Hospital Association was unfavorable. Is that correct? And who else was unfavorable?
Just the hospital association.
Okay, thank you.
Okay. Great question. Any other questions? Concerns? All right. All those in favor say aye. Any opposition? All right, so I have Delegate Morgan. Okay, all right, so Delegate Riley, Delegate Hutchinson, and Delegate Kipke. Thank you. Who does not want to be on this bill? Can you raise your hand? Oh, it's favorable. I'm sorry. Even I cannot stretch the rules, sorry. Thank you. I know. House Bill 394, Delegate Gazzoni, and she's excused today. Human Relations Commission on Civil Rights Appeal of Final Orders. It's a favorable, the analyst is Lindsay and Delegate Kerr. Lindsay.
This bill expands the judicial review available when there's a finding of no probable cause by the Maryland Commission on Civil Rights by establishing that unless otherwise specified, such a finding is a final order appealable in accordance with the Administrative Procedure Act. There are no amendments on this one.
Delegate Kerr.
Thank you, Madam Chair. It was unanimous in subcommittee. I move favorable.
It's been moved in second. Any questions about this bill? We are on Bill 394, the last one on page 1, 394. No, we did it already. That was the first one we did with appropriations. It's okay. I appreciate the questions. All right, so we did, we voted this bill right now, right? Did we vote the? It was moved, okay. So any questions or concerns on House Bill 394, which was voted favorable? Seeing none, all those in favor say aye. Aye. Any opposition? Delegate Chisholm and Delegate Riley. Okay. Thank you. We have next the second page of our voting list, House Bill 581. And it was voted favorable with amendments, state government permits, licenses, and certificates processing. It's called Transparent Government Act of 2024. It is, the analyst is Lindsay and Delegate Kurt. Lindsay.
This is an administration bill. As introduced, it requires each principal department and independent unit of state government by September 1st, 2024 to create a catalog containing specified information on each type of permit, license, or certificate that it issues and submit the catalog to the governor. By December 1st, 2024, and annually thereafter, each principal department and independent unit must post on its website a description of the application process for each permit, license, or certificate it issues. The bill also establishes the Government Efficiency Commission, staffed by the Office of the Governor, to enhance government efficiency and economic competitiveness by monitoring efficiency in the processing of permits, licenses, and certificates. And by December 1st, 2024, and annually thereafter, the commission must submit a report of its findings and recommendations to the Governor and General Assembly. There is a reprint of the bill beginning on page 13 of your packet with amendments adopted in subcommittee that push the date for the catalog back to October 1st, 2024 from September, alters the language of the catalog requirements, requires an interim posting of permit information by December 1st, 2024, and then requires a completed update on or before October 1st, 2025, and then annually thereafter. Removes the Director of the Energy Administration from the commission and adds to the commission the Special Secretary of GOSBA and the Secretary of DeWitt, and requires 3 representatives of the business community rather than 2.
Okay, Delegate Kerr.
Thank you, Madam Chair.
You're welcome.
Lindsay pretty much covered it. Was unanimous in subcommittee. I move the amendment.
Second.
They've been moved and second, the amendments. Are there questions or concerns regarding the amendments? Okay, all those in favor say aye.
Aye.
And yes,
We'll note on this.
1 second. House Bill 581.
It says that they can do it with existing resources.
Delegate Chisholm.
Did we ever get a confirmed answer on whether or not this is gonna do away with the Maryland Business Express, the MBE, and One Stop?
Yeah.
1 second.
Yeah, there was a. So the governor's office provided this statement with relation to One Stop. We do not consider the requirements of this bill to be duplicative of the One Stop portal. There are a number of different tools being used by different principal departments and agencies with the goal of consolidating their licensure and certification platforms to streamline the process for applicants as well as agencies. The One Stop portal, among many of these tools, has addressed a critical gap for the state to be able to quickly develop online forms and applications to support licensing, permitting, and other agency needs. We are considering the overall platform strategy for the state and what provides the best user experience, staff experience, and best leverages taxpayer dollars. This is something we want to further explore with the guidance of Do It leadership, who have years of experience streamlining these processes in addition to protecting our infrastructures.
Okay,
So I think
thank
that's
you.
just one of the things they're going to be looking at with this
Right.
commission.
Thank you.
Thank you for the questions. Really appreciate it. I welcome them. Any other questions or concerns? Seeing none, all those in favor of the amendment say aye.
Aye.
Any opposition? Seeing none on the bill as amended. It's been moved in second. Any questions, concerns? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing none, the bill passes. House Bill House Bill 673. Can you guys wanna, who does not want to be on the bill? No, we could do it, because, yeah,
I
yeah.
mean, there's already like.
All right, so who does not want to be on it? Delegate Shalega, Delegate Morgan, Delegate Riley, Delegate Hutchinson, okay? Thank you very much for the question. Next, we have House Bill 673, Delegate Embry, Real Property, Contract Liens, Medical Debt. It was voted out of subcommittee as favorable with amendment. The analyst is Aaron and the chair Kerr. Aaron.
This bill prohibits the creation of a lien on owner-occupied residential property by contract or as the result of breach of contract for the payment of medical debt. Medical debt is defined in the bill as debt incurred due to a medication, procedure, service, or treatment that a medical professional determines to be medically necessary. There is an amendment added that struck language that would have excluded medical debt incurred due to cosmetic procedures.
Delegate Kerr.
Like Aaron said, we had the amendment that dealt with the cosmetic procedures. And I'll go ahead and move that amendment.
It's been moved in second. Any questions or concerns regarding this amendment? Seeing none, all those in favor say aye. Any opposition? Seeing none on the bill as amended. It's been moved in second. Questions? Concerns? Seeing none, all those in favor say aye.
Aye.
Any opposition? The bill passes. Who does not want to be on the bill? All right. Everyone wants to be on it. Okay, Delegate Shalega, Delegate Hutchinson, Delegate Morgan, Delegate Riley. It's okay. Let me just make sure I get it right. Can you lift your hand up, raise your hand? Delegate Shalega, Delegate Morgan, Delegate Riley, Delegate Hutchinson, and Delegate Kipke.
This is co-sponsor.
This is for co-sponsor. Okay. All right. So it's party line. Yeah. Okay. House Bill 757, Delegate Lewis, State Board of Physicians, Supervised Medical Graduates and Cardiovascular Invasive Specialists, Bridge to Medical Residency Act. It is an emergency bill. It was voted out of subcommittee favorable with amendment. The analyst was Lindsay and the chair Rosenberg. Lindsay.
This is an emergency bill that authorizes a supervised medical graduate who is an individual who has a degree of Doctor of Medicine or Doctor of Osteopathy from an institution that meets specified standards and passed parts 1 and 2 of the United States Medical Licensing Examination to perform delegated duties in accordance with regulations adopted by the State Board of Physicians under direct supervision. The bill also repeals the September 30th, 2024 termination date of Chapter 445 of 2019, which authorized a licensed physician to delegate duties to a registered cardiovascular invasive specialist. There are amendments on page 20 of your packet adopted in subcommittee that prohibit an individual from practicing as a supervised medical graduate for more than 2 years, alters the definition of direct supervision to require the delegating physician to be in the same medical office as the patient and supervised medical graduate rather than in the presence of, and requires the delegating physician to be immediately available to provide assistance and guidance.
Okay.
With these amendments, it was a unanimous vote for the bill as amended in subcommittee. I would move the amendments.
We moved in second. Any questions or concerns? Seeing none of those in favor of the amendment, say aye.
Aye.
Any opposition? Seeing none of the bill is amended. It's been moved in second. Questions, concerns? Seeing none of those in favor, say aye.
Aye.
Any opposition? The bill passes. Who does not want to be on the bill? All right. House Bill 7, great work, Delegate Lewis. House Bill 759, Delegate Olston, Advanced Practice Registered Nurses, Professional Liability Insurance Coverage, Notification Requirements. It was voted favorable out of subcommittee, and the analyst is Lindsay and Chair Rosenberg. Lindsay.
This bill requires each advanced practice registered nurse practicing as an APRN in the state to notify a patient in writing if the APRN does not maintain professional liability insurance coverage or their professional liability insurance coverage has lapsed for any period of time and has not been renewed. Each APRN practicing in the state who does not maintain professional liability insurance coverage must post the information in a conspicuous location in their place of practice. The State Board of Nursing must develop appropriate language for the required written notification. There's no amendments.
Okay, Rosenberg.
No amendments and no dissent. This was unanimous. I move the bill.
Is removed in second. Any questions, concerns? Seeing none of those in favor, say aye.
Aye.
Any opposition? Seeing none, the bill passes. Who does not want to be on this bill?
No amendments.
Oh, no amendments. I'm sorry. Sorry, Delegate Olston. I thought I would try. Go ahead. All right, House Bill 786, Delegate Bagno, Health Occupations Limited License to Practice Dentistry Services for Adults. This was favorable with amendment, and it was Lindsay and Rosenberg. Lindsay.
As introduced, the bill authorizes the State Board of Dental Examiners to waive specified education requirements for an applicant for a limited license to practice adult in addition to pediatric dentistry. The board may grant a waiver if, in addition to other requirements under current law, the dental director of the federally qualified health center or Maryland qualified health center for which an applicant has contractually agreed to provide at least 2 years of dental services and the dean of the University of Maryland Dental School requests the waiver from the board and state circumstances exist to justify granting the waiver. The bill also establishes a pathway for practitioners of adult dentistry who receive a waiver under the bill to receive a general dentistry license. The subcommittee adopted amendments that are on page 21 in your packet that authorize an applicant to either be a dental fellow or have successfully completed a dental fellowship at another dental school recognized by the board rather than just the University of Maryland Dental School, and removes language that required the dean of the University of Maryland Dental School to request the waiver with the health officer of the public health program.
Okay, Rosenberg.
Thank you, Madam Chair. The amendment, there was no opposition to the amendment or to the bill. I would move the amendment.
Is removed in second. Any questions? Concerns? Seeing none of those in favor, say aye.
Aye.
Any opposition? Seeing none on the bill is amended. It's been moved in second. Any questions? Concerns? Seeing none of those in favor, say aye.
Aye.
Any opposition? It passes unanimous. Who does not want to be on this bill? Okay. Let's go on to House Bill 809. And that's a good bill. We need it for dentists, definitely needed. House Bill 809, Delegate Vogel, members of boards, committees, commission, task forces, or work groups, removal or suspension. This was voted favorable with amendment out of the subcommittee. The analyst was Lindsay and the chair Kurt. Lindsay.
The bill establishes, except as otherwise provided by law, that a member of a board, committee, commission, task force, or work group created by state law may be removed or suspended for misconduct, incompetence, neglect of duties, or other good cause by the individual or entity that appointed the member. An individual or entity that appointed a member may remove or suspend the member only after consultation with the chair of the board, committee, commission, task force, or work group, and the member has been given notice and an opportunity to be heard regarding the reason for removal or suspension. The bill does not apply to a standing committee of the General Assembly or a committee established under Title II of the State Government article. There are amendments on page 22 in your packet adopted in subcommittee that clarify that consultation is not required if the removal or suspension is of the chair, and also that the bill does not limit rights of a member to express views on matters of public concern to the fullest extent protected for public officials by the U.S. and Maryland constitutions.
Okay, Delegate Rosenberg.
It's
Oh, I'm sorry, Kerr.
Thank you, Madam Chair. The amendment essentially clarifies that this is not intended in any way to violate anyone's First Amendment rights. I move the amendment.
All right. Thank you. Is there any questions, concerns about the amendments? And just to clarify, this is in general, right? It's not up for a particular issue. All right. All those in favor say aye.
Aye.
Any opposition to the amendment? Seeing none? Oh, yes, is we moved in second. Is there any questions or concerns on the bill as amended? Yes, Delegate Austin.
Yeah, I was just wondering if, I don't know if council could explain or Delegate Rosenberg could explain more about the process to remove the person. So like if someone says something or does something that other people don't agree with, is the person going to be subject to removal from one of these committees? And how would that actually work? What due process protections are going to be there?
And I know that if I can, before council speaks, the amendment is very clear that it cannot be based on First Amendment. That is there for that reason, exactly for what you just stated.
And then as far as the due process concern, it does specify that the member has to be given notice and an opportunity to be heard regarding the reason for removal or suspension.
So they have due process. We thought about you, Delegate. We know you will have that question, Delegate, and we thought about you. Absolutely. My pleasure. Delegate Hill.
Thank you. So again, I guess I'm trying to see how it's operational. So let's say the speaker appoints someone to the board and they're doing their job based on why they were appointed, but maybe they vote a way the speaker doesn't want. You know, they're there because they have some expertise to loan. They're not there necessarily to be the mouthpiece of the governor, the speaker, the president who appointed them. So how is this operational? Are there complaints to the person who appointed them and then they act on the complaints, or of their own volition? Can they say, I'll take you off that board if you don't do what I tell you to do? How does this work?
So I'll clarify a couple of points. One is the reason for the removal or suspension has to be for misconduct, incompetence, neglect of duties, or other good cause. So just voting a certain way,
Okay,
I don't think would rise to that level.
okay.
Unless it was accompanied by some sort of statement on the basis of the reason you were voting that was perhaps falling under one of these. And then there are task forces and commissions and things where the speaker would be appointing people, but I also wanted to clarify that this doesn't apply to standing committees or the other like joint committees established under Title II of the state government article. So those joint committees and things that members are serving on
Right.
and reappointed every year and
So
things are shifted. That
So
is
what
not
is it,
covered here.
is it envisioned that, say, the board itself knows that Terry doesn't show up enough for meetings and we need someone else, that the board would say to the
Right.
speaker, you've appointed Terry, she's not there. And then the appointing officer would look at the stuff and say, Terry, I hear you're not meeting your duties. I'm going to take you that. I mean, the process would be the appointing officer would get some kind of complaint either from the public or from the members of the board
Right.
and then make a decision. Is that how we're envisioning this?
Yeah, I guess to give another illustration, a lot of the health occupations boards do have provisions for removal of members. For example, if they're not attending meetings on a regular basis. But I think a lot of, especially the uncodified task forces and things were often created without any anticipation of removing members. And so it's trying to mirror some of those provisions that exist in current law for some of the more robust commissions and boards and things that have anticipated a longer duration and the need to remove members sometimes.
Thank you. Okay.
Great questions. Appreciate it. Any other questions? Concerns from anyone? Seeing none, all those in favor of the bill is been moved in second as amended, say aye.
Aye.
Any opposition to the bill? Who does not want to be on the bill? If you could raise your hand. Everyone wants to be on it. All right. Thank you so much for the discussion. Really appreciate it, and the questions as well. We're now on to House Bill 820.
We just did it.
Okay, it's okay, it's okay. House Bill 827, Delegate Shi, Maryland Insurance Administration Professional Employer Organization Study It was voted favorable with amendment out of the subcommittee. We're almost done. And the analyst was Lisa and the chair Collison. Lisa.
This bill requires the Maryland Insurance Administration to study professional employer organizations and address any potential impacts on the small group market in the state. There is an amendment on page 23 of your packet that clarifies that MIA will review requirements for business participation in a PEO and to access PEO health plans. The amendment requires MIA to examine federal regulatory structures that allow participation in PEO health plans. And it specifies that MIA will address rather than determine potential impacts to the small group market.
Delegate Collison, Vice Chair Collison.
Thank you very much, Madam Chair. So professional employer organizations are currently not permitted in Maryland. However, they are an opportunity in some states. Other states have adopted them and allow businesses, small and medium-sized businesses, to incorporate these or PEOs in their health benefit package. The reason they've been prohibited in the past is they don't follow the rules of the ACA. What the sponsor and the advocates are saying is we ought to at least take a look at them and see what impact they would have. So that is why the bill is before us. And with the amendments, it was voted unanimously, so I would move the amendments.
Second.
It has been moved and second. Any questions or concerns on these amendments? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing none on the bill as amended. It's been moved. It's been second. Any questions, concerns? Seeing none, all those in favor say aye.
Aye.
Any opposition? All right, seeing none, the bill passes unanimous. Who does not want to be on the bill? Okay, everyone, great. So let's move on to House Bill 874. State Board of Long-Term Care Administrators requirements for assisted living managers. It was voted favorable with amendment out of the subcommittee, and the analyst is Lisa and the chair Rosenberg. Lisa.
This bill extends the date from October 1st, 2024 to July 1st, 2026, by which individuals must be licensed by the State Board of Long-Term Care Administrators before practicing as an assisted living manager in the state. An assisted living manager employed by an assisted living program that is licensed for 4 or fewer beds must comply with specified manager training course requirements by June 30th, 2026. There's an amendment on page 24 of your packet that clarifies the reporting requirements.
Okay, and this is Rosenberg.
Yes, this was both on the amendment and the bill unanimous in subcommittee.
Okay, so do you move the amendments?
So move.
It's been moved in second. Any questions or concerns on the amendment? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing none on the bill as amended. It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing none is unanimous. Who does not want to be on the bill? Okay, so House Bill 887, 887, Maryland Department of Health Commissions and Maryland Insurance Administration study. It was favorable. The analyst was Aaron and the chair Bagnell. Aaron.
The bill requires the Maryland Department of Health to contract with an independent consultant to study the Health Services Cost Review Commission, Maryland Healthcare Commission, Maryland Community Health Resources Commission, and the Maryland Insurance Administration. The independent consultant must seek input from the commissions and the administration in conducting the study. And by January 1st, 2026, the department will report to the governor, finance, and health HGO on the results of the study.
Bagnell.
The sponsor worked it out. It was unanimous and I would move favorable.
Second. It's been moved favorable. Any questions or concerns? Yep. Aaron is gonna go through it.
The study will look at overlap of the statutory and regulatory duties performed by the commissions, identify statutory or regulatory duties that are already performed by the commissions that may be more appropriately performed by the department or another commission or agency, identify whether and how the commissions could be streamlined to reduce overlap of duties, identify whether and how the functions of the commissions could be better aligned to improve effectiveness and efficiency, examine the alignment of the statutory and regulatory duties of the commissions with the total cost of care model and the state's participation in the AHEAD model, and recommended any changes in the commission or administrative structure that may improve the effectiveness and efficiency of the commission or agency.
Good question. Did I take the vote? Okay, okay. All those in favor say aye. Any opposition? See none. Who does not want to be on the bill? Oh, it's favorable, sorry. I wanted friends, okay. House Bill 938. Delegate Crosby, state-owned nursing homes deficiencies, citations and fines, reporting requirements. It was favorable with amendment. We took Delegate Morgan's amendment, I believe. And the analyst was Lisa and the chair Rosenberg. Lisa.
This bill requires the department charged with oversight of a state-owned nursing home operated by a contractor to provide notice of a deficiency or enforcement action by a monitoring agency. The bill adds entities to the definition of monitoring agency that may issue deficiencies or enforcement actions. The bill specifies that notice must be provided to the governor and specified members of the General Assembly within 15 days after a final survey finding and within 30 days after the contractor's final acceptance of a plan of correction or completion of an informal dispute resolution. There's an amendment on page 25 of your packet that adds the local governing body in which the nursing home is located to the entities notified in the event of a deficiency or enforcement action.
Okay, and this was Rosenberg.
Yes, this is prompted by Charlotte Hall, but would apply to all such similar nursing facilities. The amendment from our delegate Morgan would bring in local government and is a sign of bipartisanship in St. Mary's County, Southern Maryland. Move the amendment. Unless Delegate Morgan, do you want to move it? That's okay.
All right, it's been moved by Delegate Morgan, second by who? It's been second by Delegate Johnson. All those in favor say aye. Aye. Any opposition to the amendment on the bill as amended? Is it moved in second? Any questions, concerns? Seeing none, all those in favor say aye. Any opposition? Seeing none, the bill passes. Who does not want to be on the bill? All right, Delegate Morgan, thank you for working it out. House Bill 953, Maryland Health Benefit Exchange, state-based young adult health insurance subsidies, pilot program, amount of annual subsidies. This is an emergency bill. It was favorable. The analyst, it's Lisa and the chair Collison. You have been given a sheet of paper that Delegate Collison would like to explain after our analyst speaks, and then we can open the conversation. Lisa.
House Bill 953 is an emergency bill that alters the amount of funds that the Maryland Health Benefit Exchange may designate for annual subsidies under the state-based young adult health insurance subsidies pilot program. For calendar 2024 and 2025, the exchange may designate up to $20 million plus any unspent funds designated for the subsidies in a previous calendar year to be used for the pilot program. There are no amendments.
Thank you. Collison?
Thank you, Madam Chair. So just to be clear, we, in this pilot program, which I believe goes for 2 more years at least, we designated $20 million to come out of the fund that the Maryland Health Benefit Exchange has towards this program. And what you probably are getting tired of hearing me say, but I am going to say it as long as I am here, we like having healthy people in our insurance pool. This group of individuals is young and most of them are healthy. So, and they weren't signing up on the exchange, and because even the exchange programs were a little bit too expensive for them, when this became available, we saw them start to enroll in the health benefit program. There were some questions in the subcommittee around the program, and so what I've given you here are some of the responses. You can see that for an individual at age 20, so it goes by age, it also goes by geographic, but the geographic differences weren't big enough for us to show. So a 27-year-old at 400% of federal poverty level, that means they can be making $58,320. And they would pay $122 towards their insurance premium per month. A 27-year-old with 200,000 or 200% of federal poverty level, which is $29,160, would be paying $49 a month for their insurance. The eligibility, and you see the information about the family of 4 down on the bottom, and the most a person who qualifies for this program, or family that qualifies for the program at 400% federal poverty level would be paying $124 per month for their insurance. The eligibility is based on the federal guidelines and federal policy levels or poverty levels, and they're always a year behind. So these are based on the 2023 levels. The age range is by statute determined by the Board of Trustees of the Health Benefit Exchange. And in the last year, it was between 18 and 34, and 24, they're saying it's 18 to 37. The average cost, so if you put all those people together, they're paying about $38 a month for their insurance. Right now, there are, as of last week, there are 58,312 young, healthy people in our pool contributing to decrease our insurance risk. We anticipate, the exchange anticipates another 12,000 coming on this year. And a lot of that can be attributed to the unwinding of Medicaid after the pandemic. As you know, during the pandemic, for the 3 years that we were in that emergency status, everyone got to stay on Medicaid, no questions asked, and you didn't have to re-enroll. Once we were out of the emergency status, they had to re-enroll, and they are seeing great upticks in the utilization of this program to a great degree because of that. So, you know, what this bill does simply is say roll over the funds that are not used from year to year for the next year's allocation. Madam Chair, I would move the bill.
Okay. Second. The bill has been moved in second. Are there questions? I see a few. I'm going to start with Delegate Hutchinson, followed by Delegate Hill. Delegate Hutchinson.
Thank you, Madam Chair.
You're
So,
welcome.
Vice Chair, you may have just said it, but I may have missed the number. This has been in existence. How many of this population enrolled into the program?
Since it started?
Yes,
It's about 58, a little over 58,000.
58,000
Yeah.
have. And now you say that, so where's the 12,000 come from?
That's what they're anticipating growth.
The additional 12,000
Right.
above.
They're
the
within the next
58,000.
year, they think they're going to pick up, that's what they're estimating based on the increases that they've seen in the last 6 months since Medicaid is unwinding.
And based upon, and I've heard you say it many times, younger people help us and brings down the cost. Have we seen any reduction in cost because of this population being in the pool?
We've put a number of different programs in place. It's really hard to tease out what contributes to what, but we have in Maryland some of the lowest healthcare costs in the nation on our exchange. So I believe, yes, we've been successful. Before the exchange was in place, we were seeing premium increases of they capped them at 15%, but the insurance carriers were asking for 30 to 50% increases every year. Once our exchange got set up, we actually saw some decreases initially. We're now seeing increases of between 2 and 3% every year.
Great, thank you.
Good questions, Delegate Hill.
Yeah, so if we look at family age 35, 33, 4 and 1, I think that under 400%, that probably should be 224.
I'll have to check with the experts.
You see what I'm saying?
Yes.
Okay.
Yep.
And
Oh, yeah,
then-
I see what you're saying.
Yeah. And then the 58,000, that's actively on the exchange now, not cumulative over the year. So we don't know how
Correct.
many have come on and left, right?
Right.
Okay, thank you.
Okay. Delegate Bagno.
Thank you, Madam Chair. And I have more of a statement than a question. But in response to Delegate Hutchinson's question, I just did a quick national average of uninsured Google search. And the first thing that comes up is most notably Maryland, whose 2.7 uninsured rate is the lowest in our analysis and is a third lower than the national rate.
Any other questions or concerns? And if I may, on this bill, you know, over the years, we have done a lot, right, to cover people. But we learned early on, I remember like in 2011, 2012, that young people would not buy insurance, right? Because they thought they were invincible and they didn't get sick. And then we learned that if they have a bad accident and they end up in the ER without insurance, they will pay for it. And most importantly, there's so much data and studies that show that if a young person gets insurance early on, that it's a habit. And they will do so later on as they get older and they have a family and have more responsibility and more illnesses. So this has been a success, really successful to have 58,000 young people have insurance. And I have to say, my son, this is his last year on my insurance. And I said to him, honey, you better go buy it. So his birthday is in November, and you know I'm gonna send him to the exchange. Anyway, just a disclaimer. Any other questions or concerns regarding this? And thank you, Delegate Collison and the committee for your work, all of you. All those in favor say aye.
Aye.
Any opposition to the bill? Seeing none. Oh, 1 second. Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, and Delegate Kipke. All right. Who does not want to be? Oh, no, it's favorable. Sorry. All right. Thank you. So now we're going to House Bill 1002. That is Maryland Department of Health, Office of the Attorney General Investigative Authority. It is favorable with amendment, and it is Aaron and Kerr. Aaron.
As amended, House Bill 1002 authorizes the Office of the Attorney General to issue in any court in the state a subpoena requiring a person to produce documentary material for inspection, answer written interrogatories, and give sworn oral testimony. If a person fails to obey a lawfully served subpoena, the Attorney General may report a failure to obey the subpoena to the circuit court with jurisdiction over the matter. After conducting a hearing at which the person who allegedly failed to comply with the subpoena has had an opportunity to be heard and be represented by counsel, the court may grant appropriate relief. There is an amendment in your packet. Basically, the bill as introduced was drafted to the Health General article under the Office of the Inspector General's provision of the code. It was moved to the state government article and the title that governs the Office of the Attorney General. It does the same thing as the bill as introduced, which the intent was to give the Office of the Attorney General Medicaid Fraud Control Unit subpoena power.
Okay, Delegate Kerr.
Thank you, Madam Chair. The bill is amended pretty much. It's clear that it's for the purposes of supporting an ongoing investigation. You can't get documents without a subpoena. So I move the amendment.
The amendments have been moved and second. Any questions? Delegate Chisholm.
And I don't know if it's exactly on the amendment, but I'm still a little confused on this bill. So right now, the Inspector General does the investigation and then turns it over to the AG's office, and the AG is now saying, well, there's an investigation going on, but we don't have subpoena power. Am I correct on that? And does the IG have subpoena power?
If Aaron, this gives them both subpoena power?
Right. So under current law, the Office of the Inspector General for Health has subpoena power under current law. Under current law, the Attorney General in the Medicaid Fraud and Vulnerable Victims Unit does not have specific subpoena power. That's what this bill would do. It would give that office specific subpoena power for those investigations under Medicaid Fraud Control Unit.
So in real world, let's say the Inspector General started an investigation, subpoenaed some documents, got them, felt like they had a good case, turned it over to the Attorney General. The Attorney General then says, well, we feel like there's more documents or other evidence out there that may help bolster this case. We want to have the ability to subpoena more documents. Am I correct on that? Okay. Thank you.
Mm-hmm.
Just on that.
Yep. Thank you for clarifying that. That's important. Any other questions? All right. Okay. All right. You move the amendments? All right. And they've been second. All right. All those in favor say aye.
Aye.
Any opposition to the amendments on the bill as amended? The bill has been moved and second. Any questions or concerns on this bill? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing none, it's unanimous. Who does not want to be on this bill? Okay, Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson, and Delegate Kipke. Okay? Yeah, but it says et
There-
al. When it says et al. And there are other
Yeah,
people.
there's actually people on here.
Yes,
It's a
so
fine line.
basically, when you see et al., that means that we got co-sponsors, so then we can add it. Okay. And that was my doing. Okay. Okay, House Bill 1103 is the last bill that we have. Delegate Wallach, Marion Kelty Aging and Senior Social Connection Hub and Spoke Pilot Program. It was voted favorable with amendment out of the subcommittee. The analyst is Lisa and the chair Rosenberg. Lisa.
This bill establishes the Miriam Kelty Aging and Senior Social Connection Hub and Spoke Pilot Program in the Maryland Department of Aging. The goal of the pilot program is to support villages that seek to take advantage of operational proficiencies in existing systems, knowledge, skills, and resources to expand services to more residents in the geographic region. The Maryland Department of Aging must select the Montgomery County Village Consortium to implement the pilot program for 3 years. And for fiscal 2026 through 2028, the governor is required to include $80,000 for the pilot program in the budget. There is an amendment on page 28 that specifies that the Department of Aging will transfer the appropriated money to the Montgomery County Village Consortium.
Okay, Delegate Rosenberg.
The amendment and the bill were unanimous.
All
The
right.
amendment.
The amendments have been moved in second. Any questions or concerns regarding the amendments? Delegate Hill.
Thank you. I think this is a good bill. I just wanted to know, since the money's going directly to them as it should, in this report, I'm looking quickly, is there anything about the report should show how they spent the 80? 60 went to administration, 20 went for advertising. Is there any interest in knowing how the 80 was spent each year? Since they have to report anyway.
Not specifically addressed, but that would be normal report language.
Okay, because I'm looking at the things in the report and I don't see that. That's all it is. So is that necessary or desired?
I wouldn't think so.
Okay. They said they don't think so.
It does, it does say specifically what the funds need to be used for. You won't have necessarily the breakdown of that, I guess, but.
I mean, if another group wants to file or whatever, expanding it, it'd be nice to know that 60% ended up being administration. And if you don't have to do advertising, you might, I don't know. I don't think it's information that is not useful, but you can't know it if you don't have it. So I think Delegate
they have a
Rosenberg says it would
reporting?
automatically be, I think Lisa's saying it may not automatically be reported. And so,
Is it difficult to put that amendment? We'll do the amendment, okay? So on that amendment, in concept, it's been second. So all those in favor say aye.
Aye.
Any opposition to the amendment in concept that they would tell us what they spend the money on and they will include it in the report? All those in favor say aye. Any opposition? And now on the bill as amended with the second amended, all those in favor say aye.
Aye.
Any opposition? The bill passes. Okay? Thank you. Co-sponsors, who does not want to be on this bill? Just raise your hand if you do not want to be on the bill. Delegate Morgan, Delegate Kipke, Delegate Riley, and Delegate Chisholm. Delegate Hutchinson. Shalega wants to be on. All right? All right. So this is actually, if I may just have a minute, this concludes the voting, but